Hello, everyone, and welcome to this episode of Compassion and Courage Conversations in Healthcare. I'm your host, Marcus Engel, and as always, this is the podcast where I teach compassionate communication, inspire resilience, and provide perspective. I am super excited today to introduce you to a fabulous doctor, healthcare leader, expert, all around great, wonderful person, my friend, and I guess we can kind of consider ourselves colleagues. We've known each other a long time. Dr. Scott Ellner. Scott, thank you so much for being here, and welcome to the Compassion and Courage podcast.
Well, hey, thank you, Marcus. I appreciate those nice comments. It's really great to be here, and I guess we've known each other now for almost 10 years when we first met on the East Coast, and you were sharing your compassion and healthcare talks to our workforce. And you and I have been friends ever since, and you're doing great work out there.
Thank you. And so this seems like an appropriate time to tell everyone the great work that you've been doing as well. Scott professionally currently, in addition to being a trauma surgeon, Scott is also the CEO of Billings Clinic in Billings, Montana. This is the largest healthcare system in the state of Montana. And at the time of our recording right now, we are still seeing a spike out in your neck of the woods, right, Dr. Ellner?
Yeah, unfortunately, we still have quite a few inpatients who are COVID positive, pretty sick patients, which are overwhelming our ICU and putting us at about 200% capacity of our usual hospital census.
200% capacity. Wow. I want to come back to that later because this is a current issue across the world of healthcare. And I want to hear about the innovative things that you are doing there to address this. I'm not sure any of us were ever trained exactly how to handle 200% capacity in our systems.
No, it's something where to be frank, you have to show a lot of humility. You're learning on the fly. You're trusting your team. You're trusting the clinicians, our incredible nurses who are at the bedside to do their best. And sometimes it requires just sitting down and really listening and being empathetic to the situation at hand.
It's really great to hear someone in leadership saying that so strongly. I think those at the bedside know that to be true. I think oftentimes those at the bedside don't always feel like leadership understands their need to be compassionate and empathetic, and it's really good that you're having that mindset at the top of your organization. I imagine that has to carry down to your staff.
Yeah, I'll give you an example. I do something called going to the Gemba, investigating what's happening at the actual site. And 2 weeks ago, I spent a tough shift, backbreaking work in our ICU. We had 52 ICU patients that day. And I followed around one of our critical care nurses for that day on that shift to really walk in her shoes, to really see from her perspective and her colleagues, the respiratory therapists, to understand what they're going through. And I will tell you that in one case, I could see where sometimes our healthcare workforce does get frustrated and they do get demoralized because they recognize that they're doing everything they possibly can. And with this illness, with this COVID disease, a lot of times care becomes futile.
Let's bring that back around in a little bit because I love what you said there about going and observing, shadowing your nurses, especially in the unit. Could we even go back to earlier? Like, you obviously went through a lot of school and training to become a doc, and then even more to move into leadership. Can you kind of take us back to what founded your your desire to go into medicine, and then maybe expand on that to take that into why you decided to go into leadership.
Well, medicine or healthcare is an area where I found early on that you can make a difference, and you don't have to be a physician. You can be a nurse, and particularly I think back about your story, Marcus, about the people who cared for you initially when you came in after your injuries, and how they made an impact, the compassion they showed. I was Specifically, I was involved in a high-speed accident in the LA area. I was at the beach, and I was standing there by my car after a surfing session, and a motorcyclist was hit head-on by a vehicle, and he was flipped and crushed and landed at my feet during that time. I was at UCLA trying to figure out what I wanted to do with my life, and at that moment I saw this person who clearly was in distress, and as I sat there looking at this person, their arm was up in an awkward way with their hand out, and all I could do was sit down and hold that person's hand and pray. Somebody stopped on the side of the road, jumped out. It was a woman who immediately had confidence, knew what she was doing, grabbed the tray that a lifeguard nearby had brought over, and was able to put a breathing tube or intubate this patient. And it turns out that she was a trauma surgeon.
There was a trauma surgeon that just happened to pull up at this moment.
Correct.
Wow. How fortunate in that moment. Wow. So you're holding the hand of this severely traumatized patient, and you're how old at this time? Teenager?
21.
21, okay.
Yeah.
And so that really started to take you into this idea of being able to help.
I saw how this person jumped into action as a good Samaritan and had the skill set of making a difference, saving that life right there on the cracked concrete of Pacific Coast Highway. And it impacted me greatly. And I decided, actually, my parents were happy about this. I decided to not go to law school, instead go to medical school.
So you went to med school in California then?
Yes.
Okay, and then your training also at UC San Diego, correct?
Right. So after medical school, I had a passion for anatomy and surgery. So I did a general surgery residency at UC San Diego, where I received training in trauma and minimally invasive surgery. And and I went on to practice surgery on the East Coast.
And was your first job out of med school at St. Francis, where we first met?
So after surgical residency, I went to Hartford and practiced at St. Francis Hospital and Medical Center, where I quickly realized, as I became comfortable being a general and trauma surgeon, that quality and safety is incredibly important in healthcare. And I saw the need to be a champion for patient safety. It was a time where the Institute of Medicine report had come out, demonstrating that roughly the same amount of people die every year from medical error as those who would have died in a plane crash. And that happens every day. That number every day in healthcare.
It's a disturbing statistic, to say the least. I personally am so glad that you have such commitment to safety, because I am one of those patients who received a hospital-borne infection at one time over a decade ago that practically ended my life. And it was then that I personally came to know the the scariness that can come whenever you've gone into a hospital to try to correct an issue and you come out with maybe one issue corrected, but something else injured or illness. And I just can say from my experiences, thank you for being a leader and having such a great amount of diligence towards that subject.
Yeah, I appreciate that, Marcus, because I recognize that we're always evolving. We're doing more complex procedures in healthcare. At the same time, we need to continue to focus on being safe and providing high quality outcomes. What was challenging, though, as a new surgeon, somebody entering the workforce, is how do you lead? How do you lead people to buy into focusing on quality and safety? And I asked for your help to come and talk about your experiences, and you were instrumental in us really creating a movement on the East Coast around patient safety back then.
I'm glad I had some part of it. I made some good friends while I was on those visits up to Hartford.
So, a lot of people ask, how do you motivate people? How do you influence people to do some of the things like, for example, a surgical checklist, or to pause or time out before you start a surgery? And the answer is that it does require a skill set, a leadership skill set, where you need to develop a way to drive buy-in. And if you demand people to do something, well, as we've seen lately with the vaccine, not everybody is going to follow your demand. You have to win people over with data. You have to tell stories which will impact people, which I know you do very well through narrative medicine. And there were a lot of interesting ways in which we were to drive our healthcare entity at that time to be more focused on patient safety using these set of tools.
So patient safety has become obviously extremely important, but in this pandemic, where does patient safety seem to be after having such issues over the last year and a half of staffing and equipment and personnel? Where does safety now stand?
Yeah, so you can't minimize the importance of safety, and you have to actually be even more diligent. Now, right now, in our current situation here at Billings Clinic, we are totally overwhelmed. We have limited resources. We've had to build out our hallways with makeshift rooms. Essentially, we've built out 60 beds over the last couple weeks to take on the surge. And so what I hear a lot from many of our caregivers is, I don't feel like I'm providing the best care that I can. And part of that is true. We're in a crisis. And sometimes when you're in a crisis, you're dealt difficult situations where you have to do the right thing to save the most lives. As a trauma surgeon, when I was in Hartford, if we had 3 patients come in at the same time with devastating gunshot wounds, it was very hard. As the only person there, it was very hard to work on all 3 people at the same time. So you make the best of your resources. You support one another. You create team-based approach algorithms. You do things that involve critical thinking from our nurses at the bedside who are really caring for these patients. You listen to your respiratory therapist, and you take all these ideas and you formulate it as a triage group to understand how can we save the most lives under these difficult situations.
And that is true leadership right there, taking the entire organization, learning how to form a system so that we do this absolutely the best we can. That's just so beautiful. Let me ask you a question here. whenever we look at staffing, and you in a leadership position, how do you stay positive through everything that's going on? Your staff is exhausted. I'm sure that has to come out in some way as I think that's pretty much across the labor market, though. There's always going to be people that are mad at the boss. But how does that work now in healthcare, specifically in your facility, in your system? How are you able to, I don't know, every day just put on your shoes and go to work? I know it's a deep commitment to saving lives, but through this pandemic, what are the ways that you have found to stay positive and inspirational to your staff?
Yeah, as my role as the CEO, the number one priority for me is to care for our people. And many of our people who are in the trenches, if you will, are suffering right now. We mentioned earlier when we started the podcast, I go to the site to investigate. So I will go to different areas, and I will walk in the shoes of some of our caregivers to really understand what they're going through. And I learn a lot. I learn about some of the pebbles or the impediments that are in their shoes because I'm experiencing it right there firsthand. And then I can go back to some of the senior leaders on my team and say, hey, did you know, for example, something so small as not supplying 25% albumin versus 5% albumin on our supply shelves makes a difference. We need to make sure that we're incredibly diligent about how we're providing the supplies on our floors. We need to make sure that if there are policies that seem to be not doing any good or getting in the way, that we evaluate those policies. And sometimes we will make exceptions because you have to listen to the frontline caregivers and get their feedback.
That right there is the heart of everything. When I talk with people about what is narrative medicine, we've all kind of got different definitions. But if I distill it down, it's storytelling in healthcare. But if I distill it down even more, I can break it down to two words, which are active listening. And that's exactly what you're describing, is listening to your staff and to their concerns to help create policies and systems that make it easier for your staff. You don't get that by sitting in an office all day.
Well, and I'll be honest, I can't be everywhere at once. We have a large hospital here. We actually have 16 other hospitals across Montana and Wyoming that we're in partnerships with as well. But I do try to go to areas that I think need the support, that we need to understand what's going on, like the emergency department. Over Labor Day, our emergency department was getting crushed. The charge nurse on that night, she called me and I said, I want to come in and see. And so I went in there and I helped to move some patients, just to lend a hand, just to provide support, just to let people know how hard they're working and to see it firsthand. Is it always going to work out? No. Some people will question why you're there, and but if you're authentic, if you demonstrate that you truly care about them, then many times people will recognize that you're trying to do the right thing for the organization.
Where did you learn leadership?
Wow. From good people who believe that the right way to lead is to not be a dictator, but to be someone who's open to ideas, who's willing to sometimes take calculated risks and understand that those risks may have consequences with tough decisions. I learned it from many surgeons who always remained composed in the face of sometimes some difficult, challenging cases in the operating room, and watching how they handle the team and being respectful of their team. It never felt right to me that you should be yelling at anyone in the room in your OR, because that will demoralize the team and make people feel uncomfortable and afraid to speak up. So, I learned it from various people. I learned it from a nurse that I worked with many years ago. Her name was Cindy. We were partners together as far as surgical quality. She was an excellent leader. And many of the ideals and principles that she stood for still hold true to me today.
And we should also point out that you do have an MBA in addition to being a doc and a leader. Do you want to share any of that experience?
Well, I mean, in medical school, you don't learn about healthcare finance, or you don't. And so I did. I got my master's in healthcare management. Went back to school in Boston, similar to an MBA, and I learned about how to communicate effectively, how to learn about finance, organizational behavior. But I think the most important thing was learning from other people in that cohort or that class, and taking some of the leadership style and approaches that they showed, and moving that forward. Jim Conway, who unfortunately recently passed away, was a very important leader that I looked up to.
Jim Conway, was he at the university?
He was at I believe Dana-Farber, and very involved in the patient safety movement. Somebody who carried a lot of weight out there because of his inspirational style. He was one of the first to say that boards of hospitals should always start with a patient safety story, and their focus should always be on safety and quality.
And you've been able to take that message now to several different systems and facilities and organizations.
I feel blessed. I feel lucky.
With everything that's gone on in this last year and a half, I guess it's kind of a two-part question. If I would have asked you 2 years ago, what have you learned so far about healthcare, and pose that question to you now, today, 18, 19 months into the pandemic, would the answer be different?
Yeah, for sure. It's very different today because I think we've been challenged. We've been put in a situation where we've had to be nimble. We've had to think quickly, and at times be incredibly uncomfortable. What hasn't changed is that you will always find meaning in healthcare. Healthcare is such a fantastic place to be as a provider that there's always going to be an opportunity, no matter whether you work on a unit, whether you work in an office. You are making a difference in people's lives. And at the end of the day, if you can go home and recognize the meaningful contribution, and hopefully your organization is helping you see that, and explaining how they value and recognize you, that's important. What's changed dramatically in healthcare is that we have to be open to new things. Culture is very hard to break at times, and we've had to learn some difficult lessons that what worked in the past isn't working now. And I would say, as a part of what has really changed dramatically in healthcare, is we need to understand how to be more efficient, how to treat patients closer to home, so the hospitals aren't getting overwhelmed with capacity. So it's spurred a lot of innovation and opportunity.
I was just going to ask you, what's something that's on the horizon that's happening in healthcare or medicine right now, even for to get that specific? What's something that you're excited about?
A virtual medical center. Yeah, and so the term you'll hear, hospital at home or healthcare at home. I really believe that if we can provide more and more acute services to patients in their own home, through the technologies that are now being developed as we increase bandwidth across the country. Patients will not always have to drive into a brick and mortar facility, and that's pretty exciting. Is bringing the healthcare to a place where somebody resides, and in a place like Montana, where social distancing is pretty easy at times with the geographic vastness, that's going to work out well.
I love that you bring that up too, because growing up in rural Missouri, where I did, and where my parents still live, it is a medical desert. There is not an emergency room in their county. They're got on the weekends, you'd have a good 30-minute drive to get to the closest urgent care or ER. And that's nothing compared to the big sky country of Montana.
Yeah, it's very similar. Actually, we have situations where there might be a PA or a nurse practitioner who is working the only one working in a critical access hospital with several miles of nothing between that hospital and the nearest big town. And the way we look at this is, how do we help that provider in that hospital care for anything that comes in, whether they can care for the patient there with help through telehealth or telemedicine, or how can we create specialized algorithms which we can ensure that patient is transferred appropriately, safely, and affordably to get the care they need in a larger setting.
It's an amazing world that we live in, and unfortunately, well, I guess like with a lot of innovations in medicine, it took a global event, or at least a large-scale traumatic event, to bring around some of these innovations, or at least sped up the time frame that we're implementing them. Especially in a time now where we've gone through so much in the last year and a half. It's good to hear that there is still exciting stuff out there on the horizon that we've learned.
Yeah, there is going to be tremendous technology that will continue to come out using artificial intelligence, machine learning, that will allow us to be more nimble in healthcare, to meet the patient as close to their community as possible. I think our mission at Billings Clinic is to keep care local. We want to make sure that Montanans, if they don't have to travel, can get the care they need as close to home. And so with the advances in technology that we're seeing, there is tremendous opportunity to help with that. It's going to lower the inconvenience of having to drive during a snowy day, as well as hopefully lower costs, which we all know is challenging in healthcare. So there's a lot to really be positive about. It's sometimes hard to get beyond what's right in front of you with this COVID pandemic or endemic, to see beyond that. But as leaders, we have to inspire the people around us that there's hope, and there's going to be a lot to look forward to in the future.
There is hope, and that's a great segue to go into. I've got a few rapid fire questions for you, if you're ready.
You got it.
All right. So first one, what are you reading right now?
Right now, I just read a book by Doris Kearns Goodwin on leadership during turbulent times, and it's about the four presidents: Lincoln, Johnson, Theodore Roosevelt, and actually Franklin Delano Roosevelt, and what they went through during their times as president.
Yeah, boy, that would be a lot. That would be a lot. Sounds like good reading there. That's going on my list. Second question for you: if you were stranded on the proverbial desert island, and yet you could have one piece of art with you, and whether that's a film, it's a book, it's a piece of visual art, sculpture, anything like that, what's the piece of art that you would keep?
Well, I don't think this is gonna be too mainstream. What I've learned a lot recently is about these non-fungible tokens. And you can now purchase digital art, which is going crazy in the crypto networks. I would purchase an avatar that would be a constantly changing landscape of the most beautiful spots around the world.
And that is a well thought out answer right there. That's a well thought out answer for a desert island. All right, next question for you. If you could step into the skin and have one day to live the life of a fictional character, what fictional character would you like to be for a day?
Boy, fictional character, huh? I guess, well, they'd have to be fun. They don't have to be too smart. But not like SpongeBob. So maybe the Pink Panther, because Pink Panther is always inquisitive and seems to have a good time.
Good stuff. Good stuff. And then lastly, if you had the eyes and ears of the world, you had the world's largest billboard. What is the message that you would put on that billboard? What is your message to humanity?
Be kind, be safe, and be courageous.
Be kind, be safe, be courageous. And considering this podcast is called Compassion and Courage, I think that's a great billboard to have. Dr. Ellner, I cannot thank you enough for sharing your insights and wisdom with me and with the audience today. Thank you so much. And we all want to wish you continued success through the rest of this spike. And hopefully in a few months, if this continues to settle down, we'll be able to sit down together in person again.
Well, thank you, Marcus, and thanks for all of you do. You have inspired hundreds of thousands of people, and I am inspired by you, and I look forward to seeing you soon.
Excellent, excellent. Please give your staff my best.
I will.
All right. Thanks a lot, Dr. Ellner. And thank you all so much for joining us for this episode of Compassion and Courage, Conversations in Healthcare. I'm your host, Marcus Engel. This is the podcast where I teach compassionate communication, provide perspective, and inspire resilience. We'll look forward to being with you next time on Compassion and Courage.